Do you know what to do when someone is having a heart attack? Today, we will delve into the world of heart attacks, a medical emergency that's all too common yet often misunderstood. We'll explore the importance of knowing how to respond effectively when faced with such a situation. Heart attacks happen every day, everywhere, and to anyone. Your immediate and correct response could potentially save a life. Knowing what to do during a heart attack can mean the difference between life and death. Before we dive into the emergency response, it's essential to understand what a heart attack is. Simply put, a heart attack, medically known as myocardial infarction, occurs when the blood flow to a part of your heart is blocked, often by a blood clot. This blockage can damage or destroy part of the heart muscle. Imagine a bustling city with roads full of cars. Now consider a main road gets blocked. The traffic comes to a standstill, right? Similarly, when the blood, which carries essential nutrients and oxygen, can't reach the heart muscle, it can cause a traffic jam in your bloodstream, leading to a heart attack. The severity of a heart attack can vary. Some people have silent heart attacks where the symptoms are mild or even non-existent. Others may experience severe life-threatening episodes. Regardless of the intensity, any disruption to the blood flow in the heart is a serious matter. Understanding what a heart attack is will help us recognize one when it happens. Now that we know what a heart attack is, it's crucial to recognize the signs. One of the most common symptoms is chest pain. It's often described as a feeling of pressure, squeezing, fullness, or pain in the center of your chest. This discomfort may last for more than a few minutes or come and go. Another common symptom is shortness of breath. This can occur with or without chest discomfort. You may struggle to breathe, or it may feel as if you've just run a marathon even when you're at rest. Additionally, you may experience discomfort in other areas of your upper body. This can include one or both arms, the back, neck, jaw, or stomach. Some people also break out in a cold sweat, feel nauseous, or become lightheaded. Remember, everyone experiences heart attacks differently. Some people have no symptoms at all. Identifying these symptoms quickly can help save a life. If you find yourself in a situation where someone is having a heart attack, there are several steps you should take immediately. Firstly, it's crucial to keep calm. Panic can make the situation worse. Your composed demeanor can help the person experiencing the heart attack to stay as relaxed as possible under the circumstances. The next step is to call your local emergency services. In many countries, this number is 911, but it can differ, so make sure you know what it is for your location. When speaking to the operator, be clear and concise. State that you believe someone is having a heart attack. Give them your exact location, and don't hang up until they tell you to. They can provide you with further instructions on what to do while you wait for professional help. If the person is conscious and able to swallow, and they're not allergic to aspirin, administering a regular strength aspirin can be a good step. Aspirin can help by thinning the blood and reducing the chance of a complete blockage. Prompt them to chew the aspirin as it works faster this way. Meanwhile, make sure the person is comfortable. Have them sit down, rest, and try to stay calm. Loosen any tight clothing and ask about any prescribed medication they may have for their heart condition. If they do, help them take it as directed. Should the person become unconscious, you may have to perform cardiopulmonary resuscitation or CPR. If you're trained to do so, begin chest compressions and rescue breaths as you were taught. If you're not trained, the emergency operator can guide you through the process. Push hard and fast in the center of the chest at a rate of about 100 to 120 compressions per minute. Remember, every second counts during a heart attack. Your quick response can mean the difference between life and death. Heart attacks are serious medical emergencies that require immediate professional help. Your role in these critical moments is to ensure the person gets help as quickly as possible, help them stay calm, and if necessary, provide life-saving interventions like administering aspirin or performing CPR. These steps can help stabilize the person until professional medical help arrives. Remember, you're not alone in this. Help is on the way. Let's quickly recap the key points we've discussed today. We've embarked on a journey through the intricacies of a heart attack, its symptoms, and the critical steps to take during a heart attack emergency. A heart attack, also known as myocardial infarction, occurs when the blood flow that brings oxygen to the heart muscle is severely reduced or cut off completely. This happens when the coronary arteries supplying the heart with blood become narrower from a buildup of fat, cholesterol, and other substances, forming a plaque. Now onto the symptoms. They can range from discomfort in the chest, shortness of breath, to more severe signs such as breaking out in a cold sweat, nausea, or lightheadedness. Remember, these symptoms might vary from person to person and may not always be dramatic. Therefore, it's crucial to pay close attention and not dismiss these signs as mere discomfort or fatigue. We've also delved into the crucial steps to take when someone is having a heart attack. First and foremost, call for medical help immediately. Don't hesitate or wait for the symptoms to subside. Time is of the essence in such situations. Administering aspirin can also help, as it prevents further blood clotting. If the person is unconscious, performing chest compressions and using an automated external defibrillator, if available, can be life-saving. It's crucial to remember that every second counts during a heart attack. A swift and appropriate response can significantly increase the chances of survival and reduce potential damage to the heart. It's not just about being a bystander, but an active participant in someone's survival story. In conclusion, understanding heart attacks, recognizing their symptoms, and knowing how to respond during an emergency is vital. It's not merely about the knowledge, but how we use it that can make a world of difference. Remember, your knowledge and actions can make a huge difference in a heart attack emergency. Stay informed, stay prepared, because in the face of a heart attack, every second, every action can mean the difference between life and death.